Antidepressants by Jaquavius Anthony. Antidepressants are used to treat or prevent clinical depression. Clinical depression can be described as excess eating or sleeping, inability to concentrate, avoidance of companionship of other people, decreased interest in sex or activities normally enjoyed. They can also treat conditions such as OCD and anxiety disorder. There are multiple types of antidepressants. Monoamine oxidase inhibitors, which are MAOIs, triglyceric antidepressants, selective serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors, or SNRIs. Types of antidepressants. So for MAOIs, we have Etopril, Marplan, Nardil, and Parnate. For TCAs, we have doxaprin, tofranil, Pamelor, Elavil, and anofranil. For SSRIs, we have Prozac, Zoloft, Pazil, and Celexa. For SNRIs, we have Pristiq, Cymbalta, and Epixer. Pharmacodynamics. So MAOIs improve retention of neurotransmitters at the site, which makes more brain chemicals available to affect changes in cells and circuit that are impacted by depression. They also require dietary exclusion of foods such as tyramine, as it can increase critical hypotension, so it can cause low blood pressure. MAOIs are also absorbed well orally. They are metabolized oxidation and acetylation in the liver and excreted in the urine. TCAs function by keeping norepinephrine and serotonin at the nerve terminals, helping electrical impulses cross the synapse. TCAs are sometimes prescribed to patients with insomnia because of the sedative side effects. SSRIs prevent serotonin from being used up at the point of contact between neurons, where information is passed from one neuron to the next. SSRIs keep serotonin at the synapse, improving the mood. SSRIs have little to no effect on other neurotransmitters such as dopamine and norepinephrine. SNRIs block both serotonin and norepinephrine. SNRIs ease depression by affecting chemical messengers used to communicate between brain cells. Indication and usage. MAOIs are rarely prescribed because tyramine is common in many foods. TCAs are the drug choice for severe depression and inpatient treatment of depression. SSRIs are the first-class drug prescribed to treat depression. SSRIs have fewer side effects than other antidepressant medications, so it is more commonly prescribed. SNRIs are the newer drugs that are used to treat depression. MAOIs, for contraindications, we have known hypersensitivity, heart disease, hepatic or renal impairment, headaches, cerebrovascular disease, pregnancy and lactation, or foods containing tyramine. TCA's contraindications are pregnancy and lactation, cardiac, kidney, liver, and GI disorders, glaucoma, obesity, and seizures. For SSRIs, we have pregnancy and lactation, patients with thought of suicide, diabetes, bipolar disorder, or eating disorders. SNRIs contraindications are patients using MAOIs, hypersensitivity to any ingredients of the medication, blood pressure may be increased with SNRIs, and the risk of bleeding may be increased as well. So for adverse reactions and side effects for MAOIs, it includes nervousness, headache, stiff neck, increased heart rate and blood pressure, diarrhea, and blurred vision. For TCAs, it can cause dry mouth increased appetite, weight gain, drowsiness, blurred vision, constipation, dizziness, urinary retention, postural hypotension, irregular heart rhythm, and headache. For SSRIs, those adverse reactions are sexual dysfunction, anorexia, diarrhea, sweating, insomnia, anxiety, nervousness, tremor, fatigue, dizziness, drowsiness, and headache. And for SNRIs, we have nausea, constipation, dizziness, drowsiness, anorexia, excessive diaphoresis, dry mouth, and weight gain. So for the doses and administration for MAOIs, such as Selageline, it is available as a tablet that dissolves in your mouth or a patch that you stick to your skin. The typical starting dose is about 1.25 milligrams a day for 6 weeks. For TCAs, they are also available in oral tablets, capsules, or solutions, and the drug life in TCAs is high, so those starting doses are typically low. For SSRIs, they are usually taken in tablets, depending on the specific SSRI and how severe the depression is. You usually take between 1 to 3 tabs once a day. So for the SSRIs, it usually takes 2 to 4 weeks before side effects tend to show up. SNRIs are delivered orally, usually in the form of tabs or caps. It is recommended to take the SNRIs in the morning with your breakfast. So for patient education, as said multiple times, MAOIs, you should avoid food containing tyramine. For TCAs and SSRIs, you would avoid alcohol. For SNRIs, you would avoid ibuprofen, Advil, Motrin, aspirin, Roforin, and other blood thinners. So with all antidepressants, you would recommend to the patient that they consult their doctor or physician before discontinuing the medication. And these are my references.